Thanks, Felicity. My name's Annette Catalaris and I'm the Director of Professional Medical Education at the Sydney Medical School, and I'd like to welcome you to the webinar and to welcome my co-speakers, Dr Rod Bishop, Dr Adam Hastings and Miss Ruth Bunby. And we're here to talk about two courses that we'll be delivering this year in critical care and clinical neurophysiology. And if it worked, it would be much better. Okay, now just to be clear at the beginning, the critical care degree is only open to students who hold a medical degree, but the clinical neurophysiology degree is available to those with a science qualification. Ruth will talk about this more later, and those with a medical degree. I just want to talk about the degree structure in general. So each unit of study is worth 6 credit points. 4 units of study grouped together from stream-specific units of study make up a graduate certificate, and this can be converted into a graduate diploma with 6 units of study. A master degree requires 8 units of study, and if you've got a distinction average, you can apply to complete the advanced option, which is a research option and requires another 6 months of research. Just to be clear also that once you're enrolled, you can apply to upgrade your degree or move to a lower credential. So if you if you start off with the graduate certificate and you're really enjoying it, you can convert to the graduate diploma. And likewise, if you start off in the master program and you feel that you can't complete, you can take the graduate certificate. There is an exception to this that Ruth will discuss in the clinical neurophysiology for scientists. In general, this is what the structure looks like, and I'm talking mostly about the master degree here. To complete the master degree, you must complete Introduction to Clinical Epidemiology, and if you're doing critical care, you also need to complete the capstone and 4 stream-specific units of study and 2 elective units of study. If you're enrolled in clinical neurophysiology, you must complete the Introduction to Clinical Epidemiology and the basic sciences in clinical neurophysiology, 4 stream-specific units of study and 2 elective units of study. If you're undertaking the graduate diploma, you must do the Introduction to Clinical Epidemiology and the stream-specific requirements and 1 elective. If you're doing the graduate certificate, you need only complete 4 stream-specific units of study. Just to tell you the bad news, the price per unit of study is about just under $3,500, and you pay as you enrol. So if you're only doing 1 unit of study, you pay for 1 unit of study. If you're planning to complete the whole degree this year, you would pay the whole amount, but in 2 lots per semester. For some of you, fee help will be available, and that's all the information for that is on the website. And unfortunately, we have no Commonwealth supported places for any of these degrees. Now, just to be clear also, the electives can be chosen from a general list, which we'll show you, or from your stream-specific units of study. So if you're really enjoying the specialty you've chosen, you can complete 6 stream-specifics plus the capstone or the basic sciences. I guess you've got to ask yourself, after all the degrees you might have already done, why you would undertake further postgraduate study. And there are a number of reasons. For some of you, it will be to improve your content knowledge. For some of you, you're preparing for college examinations and you want to get a head start and get a framework and get a clinical understanding of the basic sciences. There's non-technical skills that we're really pleased to be offering in these degrees, and they include things like communication and decision-making skills, leadership and clinical education. And it's these courses that will often make you stand out amongst your peers and will often help you stand out in an interview setting when you're applying for a job. So think hard about the non-technical skills that you want to gain from this degree. Also, we're very keen to help you understand clinical epidemiology and the practice of evidence-based knowledge, evidence-based medicine, and of course to spark your interest and develop your skills in research so that people who finish these degrees have a lifelong interest in clinical research. We've presented both degrees together in this webinar today because there's significant overlap, and we know from last year that many of the people enrolled in the critical care degree are hoping to become anaesthetists. It's also, and so there's a lot of synergies between the two degrees, both for anaesthetists and intensivists, but we'll talk more about that later. But what we've done is make some of the clinical neurophysiology units available in the critical care stream. And remember that you can tailor the course to your needs. So I've talked to a few of you already, and for example, some of you have already completed a Master of Public Health and have asked me if you still need to complete an introduction to clinical epidemiology. And the answer is no, you can apply for a waiver. So just as a general principle, I'd just like to be clear that a waiver is granted if you can prove that you have covered the course content in another setting. In that case, you still need to complete the same number of units of study to fulfil the requirements of the degree, but you don't have to complete that particular unit of study that you want to be exempted from. A credit is only granted when you've undertaken an equivalent unit of study at an academic institution, but you haven't yet counted that unit to another degree. So you can't double count your units of study. And now I'd like to hand over to the course coordinator of critical care, Dr. Rod Bishop.
Hello everyone, both of those of you online today and obviously those who are going to watch this in the future through the web page. My name's Rod Bishop. I'm the Director of Emergency Medicine at Nepean Hospital and the course coordinator for the Master of Medicine in Critical Care. And so firstly welcome you to the course, those of you who have enrolled and accepted your enrolment, but also perhaps those of you who are still waiting to decide to accept. Critical care has been set up really to provide a complementary education to you to what you're learning as clinicians in the clinical setting, and for people who are already well on training or finished their training, those extra skills that set you apart. And the next touched on particularly around clinical epidemiology and evidence, and they're the two of the units which are compulsory if you complete the master's course. And what we hope to really give to you in those two units is the ability to think critically and think independently so that your practice is guided by your own experience and your own assessment of the evidence that's out there, rather than relying on being told what to do by eminent professors or drug reps or equipment manufacturers. We want you to be deciding your own practice and what's going to work for you. So they're the two key elements of the extra skills. But it's been structured to offer things both for relatively junior doctors just starting out on training, those halfway through training, and even specialists who finish their training. So I'll just show you some of the stream-specific units. As I said, the two that are compulsory if you complete the masters are the Introduction to Clinical Epidemiology and then the Evidence and Ethics units, which is the capstone unit that you have to complete to satisfy the requirements for the masters. And they're essentially around being able to evaluate the evidence and critically appraise it and make your own decision on how you're going to practice. There's clearly basic physiology, pharmacology, pathology, and anatomy, which is aimed at giving you the critical care context, if you like, of those subjects. You will have covered much of that as an undergraduate, but this is aimed at giving you information to help you practice in a critical care environment using those particular basic sciences, and they will of course then help you towards the first part examination for those who are coming in at that level. There's the requirements for advanced trainees both through the College of Emergency Medicine and anaesthetics are met through completing these core subjects, and I'll talk a bit about that later. Then you'll see that there are other particular knowledge-based subjects such as around retrieval, both the clinical medicine retrieval and the operational environment, subjects around pain management, and as you'll hear from Adam around the neurophysiology subjects. But there's also more cognitive things. We're going to be starting a unit of study on simulation and how to teach simulation. There's an excellent rule on communications in the clinical environment and decision making. No matter which part of a critical care you work in, be it anaesthetics, intensive care or emergency medicine, you'll be working in teams where often the environment's uncertain and often chaotic, and being able to communicate effectively in a team is so important. And then, as I said, you end up doing the evidence and ethics as your final study. So there are stream-specific units. You can see there's a mixture of both pure knowledge sort of stuff and some more cognitive elements there. Well, then there's some electives that you can choose. You could choose all your subjects from those stream-specific, but you can see here you get a range again of both cognitive sort of stuff as well as pure didactic. So diabetes, pain in children, more clinical, but then things like quality and those sort of subjects. Gives you a chance to choose things that may help you in your practice or what you're interested in. And you can choose two of those as well as the stream-specific subjects. And there's specific questions about any of those. I'm happy to answer them. There's also specific information about each of those units of study on the web page. So how you might tailor your degree depends on what area of critical care medicine you're wanting to go into. And I've given some examples here. So if you're more interested in emergency medicine, then purely clinical communication and decision making would be very useful. The retrieval units of study would be very useful, and acute pain may be very useful. Whereas if you're heading more towards, say, anaesthetics or intensive care, again, clinical communications, but there's some neurophysiology subjects there and more pain subjects. So you could just choose subjects that of interest to the area of medicine you're going to go into in practice. All three colleges have, as you know, some requirement for some sort of study. The Australian College for Emergency Medicine has what's called the 410 project, and that's now met through university courses. And if you complete the Master of Medicine, you'll satisfy the ASIM requirements for that through Introductory Clinical Epi and the Evidence and Ethics unit of study. They also recognise Introductory Biostatistics unit, but you wouldn't need to do that if you'd completed these other two units. ANSCA satisfies the scholarly role option B, both at the grad cert level and the graduate diploma level by completing Introductory Clinical Epi, and if you do a master's, obviously you'll go on and do the evidence and ethics. You do need to notify the college that you're doing that, but you'll be granted that'll be granted automatically as it's been prior approved. And for intensive care medicine, if you go on and do the advanced option, that will fulfil the requirements for a formal project. So you can see there's some carrots there for those of you in advanced training that by completing the masters, you'll also complete those requirements for the three colleges. So I'll hand now over to Adam, who will talk to you a little about the clinical neurophysiology units of study.
Thank you, Rod. So my name is Adam Hastings. I'm an anaesthetist from Westmead Hospital, where I work predominantly, as well as at Westmead Private Hospital and some other hospitals around Sydney. And my practice is largely based in cardiac and neuroanaesthesia, and I've had a fairly recent increase in interest in the use of clinical neurophysiological techniques for intraoperative monitoring in association predominantly with neurological surgery. So I'm going to talk to you a little bit about the clinical neurophysiology courses that we've put together, how they've come about and how we've tried to structure them to meet a wide range of potential applicants. So neurophysiology in clinical practice is an increasingly frequent undertaking. We use a whole range of neurophysiological techniques, not only for diagnostic purposes, but more recently for procedural guidance and for ensuring the ongoing welfare of the nervous system during high-risk procedures, both operative, formally operative and non-operative. Intraoperative monitoring and the use of neurophysiology techniques has traditionally been a realm of neurology, in particular a subspecialty realm of neurology, but that's changing recently with more and more people becoming involved in this area, and the vast majority of those are not actually trained as neurologists. Frequently we see that these techniques are being used as an adjunct to the techniques used by anaesthetists in their daily practice as part of patient welfare monitoring and guidance for proceduralists. And also recently we've seen an increase in the use of similar sorts of techniques in diagnosis and prognostication in patients in intensive care and emergency care settings. Now, until recently, there have been no formal clinical training opportunities in Australia, and certainly from what we can understand in the Southern Hemisphere, for the development of clinical neurophysiological skills outside of the opportunities that are made available within the training programs for neurologists. Indeed, most of the scientists and technicians and clinicians, doctors that are using these techniques, have learnt through on-the-job training with their education provided by their peers, and there being a reference to published texts, but really no formal educational opportunities. However, with the increasing complexity of these techniques and their increasing use, the demand for service is outstripping the ability of the limited number of providers to actually meet and provide those services. And the informal training opportunities, the peer-to-peer training, is certainly being overwhelmed with the increasing number of people wanting training in this area. And as such, we've tried to put together a course that meets some of those requirements. Certainly with the increased reliance on neurophysiological techniques in the last few years for therapeutic decision-making, particularly in neurological surgery and spinal surgery, many practitioners have felt that they've become at risk for providing guidance for procedures without having any formal training to back up their decision-making. Due to the fact that the potential applicants and the clinicians who work in neurophysiology come from a wide range of backgrounds, we've had to provide a course structure that is not all-encompassing, but certainly makes allowances for different backgrounds and for different areas of employment. Certainly we have people working in clinical neurophysiology who've come up through a scientific pathway and have science degrees. We have people who've come through a technical pathway and don't have degrees relevant to this sort of work, but have extensive on-the-job training. And we have a number of physicians, particularly lately anaesthetists, who have their general training skills, but no real opportunity to have learnt this information before. And so we're trying to provide educational opportunities that meet all these groups. The other thing that really makes it interesting in the way that we have to structure this course is that people who use clinical neurophysiological techniques, be it for diagnostic or interpretive purpose, tend to work in one particular environment. Certainly the scientists and the technicians often work in a non-operative environment, in a diagnostic lab, often associated with a large tertiary referral centre, and really don't have a lot of experience in intraoperative sides, whereas lately a lot of the intraoperative clinicians do only that and have very little activity in diagnostic procedures. So we've tried to develop some overlapping course pathways that allow our students to tailor their learning to suit not only the background from whence they can, but also their individual clinical environments and the requirements, the skill requirements that those environments have. So the subjects that we are making available as stream-specific subjects for this course are listed on the slide. Basic Sciences in Clinical Neurophysiology is a core subject. It contains all the presumed knowledge that we have for people undertaking this course and is very heavily invested in understanding anatomy and neurophysiology and the technical sides of using devices to monitor biological electrical signals. Introduction to Clinical Epidemiology is a well-established unit that features also in the critical care course, as described by Dr. Bishop. Diagnostic encephalography is a subject that is designed to meet the requirements of people working in diagnostic labs and is an introduction and an understanding of all the basic techniques associated with EEG monitoring and all the commonly seen pathology and diagnostic tools. Neuromonitoring and anaesthesia is a very general subject, and it is designed to have give an in-depth look at some of the techniques that are used on a day-to-day basis providing anaesthesia for non-neurological surgery, where we increasingly use complex electrical signals to glean information about the welfare, particularly of the brain, and to try and make decisions about appropriate administration of anaesthesia. And we think that that's a subject that will appeal to everybody who has an interest in anaesthesia and intraoperative care, and not just people who provide intraoperative clinical neurophysiological monitoring techniques. Intraoperative monitoring 1 and 2 are particularly designed for people who are going to provide monitoring during neurological and non-neurological surgery at-risk structures, particularly looking at things like multimodal monitoring for spinal surgery, for intracranial surgery, and for extracranial surgery where neurological monitoring is required. Clinical neurophysiology techniques is a subject that is designed to encompass all the other techniques that you would generally see in an outpatient laboratory that are used for diagnostic purposes. And there is a significant amount of overlap with the techniques that are used for intraoperative monitoring. However, the environment in which they use dictates the way in which those tests are undertaken and interpreted. And so we've tried to cover those particular techniques in the outpatient setting in a unit of itself. Advanced electroencephalography is for people who have a good understanding of all the content in the diagnostic electroencephalography subject, and involves a more in-depth look at complicated EEG monitoring cases, intraoperative monitoring, pediatric monitoring, stereotactic EEG monitoring, all sorts of complex EEG techniques that would not necessarily be seen in every outpatient laboratory. Now, the other thing to point out is that some, but not all of these units of study, these stream-specific subjects, have face-to-face practical components. As shown in this list, the asterisk indicates where that particular subject has a face-to-face practical component, and that will be an intensive face-to-face experience over a course of 1 to 2 days for each of those subjects. And further details of those will become available in time. There are a number of electives that are available through this course as well to provide a broader range of subject matter and to try and allow students to examine ideas and concepts that expand beyond purely just their clinical work. So we see here a number of overlapping subjects with the critical care course, the pain subjects, the leadership, biostatistics, and clinical communication and quality and safety subjects. These are all available as electives in this course structure as well. We've put together 2 suggested course pathways based largely on the environment in which students will work. For those who predominantly practice in a non-operative setting, so an outpatient referral setting or a large hospital setting, we suggest that the basic sciences unit is undertaken, as this is the core unit, and then the diagnostic and EEG and advanced EEG modules is appropriate, along with the clinical neurophysiological techniques. And we believe that covering these topics will give a very good and thorough examination and understanding of all the common procedures that are used in that setting. Whereas those applicants who work in an operative setting, and undertake intraoperative monitoring, are recommended to undertake the basic sciences course, as it is as the core subject, and then neuromonitoring and anaesthesia to understand all the monitoring that goes on in every single operation, regardless of whether or not neurological structures are particularly at risk. And then the 2 intraoperative monitoring subjects, 1 and 2. Intraoperative monitoring 1 will look particularly at the different techniques and examine each technique in isolation, look at the way in which those techniques are employed intraoperatively, whereas intraoperative monitoring 2 as a subject will tend to take all that information and amalgamate it and provide information about appropriate clinical decision making using multimodal monitoring in complex surgical settings. However, despite having come up with a couple of pathways depending on where you work, we would really like our students to tailor the course to suit their requirements. The Introduction to Clinical Epidemiology subject is available and is highly recommended, and indeed it's a requirement for college accreditation for students undertaking the graduate diploma or the master's study, certainly for ANZCA, and it is as well for the Emergency Medicine College. For Dr. Bishop's already indicated some of those requirements before. They overlap regardless of which course structure you're undertaking. We certainly have the ability to provide dual field training for students undertaking certainly a master's level course, which would allow you to undertake subjects that cover work in both the operative and the non-operative field for the people who do work in both environments. And the elective units, as we've discussed in that previous slide, are also available to allow you to tailor the course to not only your interests but also your workspace. So I'm going to hand over now to Ruth Bundy, who's going to talk about how this course meets the requirements of some of our surgical science colleagues. Thanks, Ruth.
Hello, my name's Ruth Bunby. I'm a senior scientist at Western Sydney Health. The question's often asked clinically, why would scientists want to do further study? Most state health departments are now employing graduates from university as scientists, and our awards are now tailored to that. So to progress our careers, we need to keep continuing our professional development. It's also very important that we're standardising our practice, because until recently technicians were trained on the job and you were trained by whoever was senior in your department. So really you're only as good as the person who trained you. What we're looking for is some standardisation across the country for neurophysiology to ensure that patients get the best quality care, and that we can also retain staff and develop the industry in this country like it is internationally. Just because you have a degree doesn't mean you know how to do neurophysiology. There's a lot more to learn on the job, and it's very important that we don't isolate the theory from the practical. With this course, we're given a very good theoretical basis of how to do the tests that we do in a laboratory or perform IOM, but it's also intended that it's done alongside some work and some experience in the clinical department. ANTA and the ACNS, who are our Australian societies for scientists at the moment, are both very keen to work towards accreditation. To achieve accreditation, we need to have a higher education degree. So this is really the first step in that process. And in the future, hopefully, this will be a step towards registration for scientists. At the moment, departments are understaffed, we lack resources, and we find it hard to train people because we're understaffed and lack resources. So it's very important that people who are working in the industry can find a way to equip themselves with the knowledge that they need and pick up that theoretical understanding. This course really does give us the ability to pick up that very good basis of what we need to know when we're working. A standardised teaching and training pathway ensures that we'll have good quality outcomes and that we'll have people around to do this job for years to come. It's also a great opportunity for those of us who are already working in the field. We can enter the course with our work experience, so it's not undermining the people who are already out there who've been putting in the hard yards for the last 20 to 25 years. We can still apply to do the course, brush up on that theoretical background, and then come out with the same qualification, and it certainly does not undermine professional experience, and it provides us a great professional pathway for newcomers, which should help us to retain staff and also to continue to develop the industry. So we employ people as science graduates. It's a good idea to then find your way around a lab, but then progress your understanding. And a lot of people who I've spoken to who are trainees in departments, this is their main frustration, that they're not being able to pick up that in-depth understanding. They've got their basic science from whatever course they came from, but they're not specifically trained in neurophysiology, and it's really important that we understand what we're looking at when we look at a trace so that we know who to notify and what the next step is along the process. This is the clinical assessment stage, and then once you've married those two up, the theory and the practical, then you really should be able to go out there and work anywhere. And this is the aim that we're working towards as an industry at the moment. So the Masters is a really exciting move in stepping towards attaining that goal for our industry. So as I said before, it's very important for us as scientists to have professional recognition and to find our place in the system, in the hospitals. It's already an industry that has people from lots of different backgrounds working in it, and it's sometimes hard to work out where as neurophysiology technicians or scientists we fit into the structure. A standardised education program helps to fix this problem. And at the moment the associations want this, but they obviously don't have the resources to develop courses. They are keen to see them implemented and do support programs such as this coming out and giving us something to train us up. The aim is that at the completion of study is reflected employment conditions. So in some states when you obtain a Master's it means that your pay rate may go up. It doesn't always mean this, but it's certainly the direction that we're heading in the industry. The admission requirements to the degrees for science, a bachelor degree in a health-related discipline is needed, or a minimum of 5 years professional work experience. The master's degree requires 12 months experience before you can complete the degree, and a bachelor degree in health-related discipline with first-class honours or second-class honours, or alternatively a pass in a bachelor's degree in a health-related discipline plus work equivalent to first or second-class honours. Or complete the grad certificate or equivalent. So there's several entry points to the program, and as Annette's already explained, you can upgrade or downgrade what you've enrolled in before you finalise your qualification.
Thanks very much, Ruth, and thanks for staying on the line. I'd like to open this up for questions now. Does anybody have any questions? Anything they'd like clarified? Any questions to ask? We've tried to communicate a lot of complex concepts. Don't be afraid to ask for clarification on anything.
Is the clinical neurophysiology course, is it possible to undertake an elective early on if offered, e.g. intro biostatistics?
Okay, so I hope you heard the question. In the clinical neurophysiology course, is it possible to undertake an elective early on if offered, for example, intro biostatistics? And the answer is yes. You don't have to. These are the only requirements of the degree in terms of the order of units of study you take. The capstone unit in critical care should only be undertaken once you've completed most of your degree, and the basic sciences unit in clinical neurophysiology is a prerequisite for all the other units of study. So you must have completed that before you undertake the other units. Stream-specific units. You can do your electives and introduction to clinical epidemiology at any time in that degree. So that's an important thing, especially if you're preparing for college examinations. So you might want to dip in and out of the degree. You might want to do your electives early on if you're in your early postgraduate training, and you might want to complete your clinical sciences as you're preparing for your college examination. Any other questions? I think that's a question. I can't see the question.
There's one which is, how do you apply to do an elective biostats then it's not offered on the site?
We can, okay, so this is an important point as well. If you want to do an elective that is not listed, you can request the course coordinator to approve that elective. So if we think that elective is appropriate but we haven't listed in the degree, we will allow you permission to enrol. So if you are unable to enrol but you're keen to, send us an email or give us a call and we will organise permission for you to do that.
This isn't a question from an attendee, but I just wondered how difficult would it be for someone interstate to do any of these degrees?
Okay, good question. How difficult would it be for anybody interstate to do any of these degrees? The answer is that we have made it as easy as possible for people interstate to do our degrees. And in our critical care cohort, I would estimate that a half to two-thirds of our degree, people enrolled in our degree, are not located in Sydney. So the bulk of the teaching is delivered online or is delivered virtually. Most units, as Adam pointed out in clinical neurophysiology, have some face-to-face component, but that's generally delivered as a 1 or 2 day intensive. It's not spread throughout the course. The exception is anatomy in critical care, and that requires 3 separate full days because you spend that time in the anatomy lab with cadavers, and that's an extremely valuable part of the anatomy course. All others are developed in an intensive block. We'll try and give you as much notice as possible as to when the face-to-face days are. Some of those dates are already on the website, and those that aren't will be put up very soon. The other thing, and I'm hoping we're going to be able to do this again this year, is that last year, for the first time in an Australian university, we provided the ability to do your examinations online, invigilated, meaning that you did not have to come to the university and you did not have to go to an examination site, but you could do it from the comfort of your home or wherever, provided you met all the technical requirements, and somebody logs in from a company, a third party, to watch you on video while you complete your exam. And students loved this option because it meant they didn't have to come to the university, especially just to sit an exam. Any other questions? Just like to reassure you that we're happy to take questions at any time. I'm always available to take your call, 91140508, and that's a 02 prefix, and I can direct your call to the relevant course coordinators or unit of study coordinators if required. And I want you to also understand that there is a lot of flexibility so that you can reorganise your units, you can come and go as you require. And the other thing is that if you realise that you have changed your mind on what specialty you want to do, depending on how much of your degree you've completed, there is some flexibility in changing streams.
I was asking for your phone number again.
That's 02-9114-0508. Always dangerous to give out your phone number, but happy to take calls.
What's the minimum number of credit points that you could take per semester?
The minimum number is 1 unit of study, which is 6 credit points. The other thing is that you can't complete the master degree in under 1 year, but you can take up to about 5 years to complete it if you want. If you're working full-time, most people would not want to undertake more than 2 units of study per semester, and depending on what those units of study are, you might even consider 1 unit of study. So it just depends how proficient or busy you are in your current job and how demanding those units of study are. So just to give you an idea, a unit of study is made up of about 130 hours of learning. So you should put aside roughly 10 hours per week on average to complete that unit of study well. So that includes lecture time, assessment time, study time, assignment time. Okay, any other questions or we'll wind it up?
I'll just send your phone number to everyone. 91140508.
Yep. All right, well, thank you for joining us. enrolments close on the 31st of January. Applications close on the 31st of January. So if you haven't yet applied, please do so very soon. I do want to reassure you of one other option, and that's what's called census date. And what that means is that if you do apply for the degree and you're accepted and you enrol and you start the degree and you find that it's either not for you or you just can't cope, you have until the 31st of March to withdraw from that unit without penalty. And it's really important you know that you have that out if required, because that doesn't appear on your testament and you get your money back. So without any penalty, provided you formally withdraw by the 31st of March, you can try before you buy, in a sense, and make sure it's for you.
And go to our website.
Yeah, go to our website for all the information. Sometimes it's hard to navigate. Sometimes a Google search will help you get to the point that you want to get, but all the information is there. All right, thanks very much for coming. See ya.